What are some ways that I screen people to know if they would benefit from pelvic floor physical therapy? I have two. One of them is called the Cozean pelvic screening protocol, and the other one is the PFDI, pelvic floor disability index. And depending on how people rate themselves on that, kind of helps me with my treatment. So if you're having some urinary leaking issues or some heaviness things and you check a lot of boxes in that area, but then you also check some boxes for difficulty pooping, then it kind of makes you think, oh, I bet some backside issues is causing some issues in the front. Or if you're only having pelvic pain in the front of you, but you also suffer from constipation or nerve issues, maybe all of this space back here is full of poop and it's pressing on some things that you're actually only feeling it in the front of you. And so how people answer those different questions, the Cozean screening tool or the PFDI, will help guide my treatment. And I like it. I have everyone fill one out for me, the PFDI, but the Cozean screen is for anyone. So a couple of the questions that they ask on the Cozean screening protocol is sometimes you have pelvic pain. You remember falling on your tailbone. Sometimes I experience one or more of the following urinary symptoms: loss of urine, unable to completely empty your bladder, having to void within a few minutes of a previous void, pain or burning with urination, or difficulty starting or stopping a stream. Other ones are I often have to get up to urinate 2 or more times a night. I sometimes feel increased pelvic pressure. I have a history of low back pain or sciatica or tailbone pain. I sometimes experience one of the following bowel symptoms: loss of bowel control, feeling unable to completely empty my bowels, straining or pain with a bowel movement, and difficulty initiating a bowel movement. Sometimes I experience pain or discomfort with sexual activity. Sexual activity can increase one or more of my other symptoms, or prolonged sitting that increases my symptoms. And all of those things, to me, if you checked 3 or more of those things, then you would benefit from a pelvic floor specialist. So let's say you don't even think you need to, but you have low back pain, increased pain with sitting, and you fell on your tailbone a while back. Something to consider. So remember, you are fearfully and wonderfully made.